Hello, practical nursing students. This is Darlene LaPresto, one of your nursing instructors. In today's video, we're going to cover the insertion of a straight cath. So we've already done an indwelling Foley catheter with a balloon. Now we're going to do a one-time straight catheter for checking urine residual. I have my supplies here, ready to go. We have a bath blanket to keep the patient comfortable. We have a wash basin with warm soapy water to clean the perineal area. Towel to dry, some gloves, our kit, straight cath kit that has everything we need in it, and then an extra pair of sterile gloves, always, just in case. So we would come in, do our GNAP with Mr. Smith. Hey, Mr. Smith, how are you? My name is Darlene. I'm a nursing instructor at Jackson College. I'm here to put I'm here to do a straight cath with you. You know, we just did that bladder scan and it shows that you have about 600 milliliters of urine in your bladder, and I know you're pretty uncomfortable from that. So we called the doctor and he said to go ahead and do a straight cath one time. Are you familiar with that procedure? Oh, okay, they did it yesterday too. Okay, very good. All right, well, why don't you give me your name and date of birth? All right, and any allergies? No? Okay. Well, why don't we get started? This is only going to take me about 10 minutes. Okay. Is there anything that I can get you? Are you in pain? No pain? All right. I'm going to go ahead and lift your bed up. And I brought a warm blanket for you. Get you high in the sky here. I know, that's warm, isn't it? Just came out of the oven. We go down to surgery and get them, and they always feel really nice. Now, I know that they gave you some morning care this morning, but our procedure states that we still have to clean your perineal area before we do this procedure. So that's what I'm going to get ready to do. So I'm going to expose you, but I've got you covered up as much as I can. All right? All right, so warm soapy water, hand hygiene, gloves, you can do the mitt with your washcloth, or you can do the four corner. I'm going to do the four corner again. So we start at the meatus, hold the penis firmly and doing a circular motion around the meatus, and then switch with the other corner, circle around the meatus, and then I'm going to just rinse, change my corner, and then for the shaft, hold firmly and just stroke top to bottom, change your corner, top to bottom, and then pat dry. Okay, so we're all set with that. Hand hygiene. All right, so we've got our catheter kit here. We want to make sure that the catheter kit is intact, that we have an expiration date, 2024, all right, and it doesn't appear to be soiled or broken or anything. So let's go ahead and open it front to back. I see a catheter in this one. Okay. I'm looking for the gloves, which look like they might be buried. So what I'm going to go ahead and do is open my own gloves. And this is why you always bring 2 pair with you, because you just never know with these kits how they're going to be. Okay, up off the table. Okay, we can do that. We'll fix it later. thumbs out, hitchhiker thumb. There, so since I'm still sterile, I can fix this right up. There we go. All right, I'm not going to worry about my wrists. Okay, so since this is a sterile tray, I'm going to reach inside, and a lot of times you can place it between the patient's legs before you don your sterile gloves, which is probably the better method, but I'm going to go ahead and place it here so it's right in reach. We want it right in our working area. A lot of times the hospital or the facility will require a urine specimen upon insertion of a catheter, but we're not going to do that today. But just so you know, you might be asked to do that sometimes. There's my sterile gloves. I'm just going to lay them on my sterile field there in case I need them for later. Now this is a drape, a sterile drape that we can put underneath the area where we're working, so shiny side down. And what we're going to do is we're going to kind of wrap it around our hands, and we're going to slide it under the perineal area, and then we're going to pull our sterile hands out. It also comes with a sterile drape with a hole in it, specifically for male. The only thing you have to be careful with is kind of shaking it all around. So I'm going to just kind of lay this over my area. Sometimes they get in the way, sometimes they don't. Okay. So there's unfortunately no cotton balls in these, but there's a catheter. Oh, these are the betadine swabs, that's right. I'm looking at my helper here going, where are the cotton balls? These are better. Maybe. There we go. Okay. Now I'm still sterile. I'm going to pull all these out because once I touch him, I'm not going to be sterile anymore with this hand. So I'm going to go ahead and touch him. And we're starting at the tip of the meatus again, right to the center, and roll around, making a circle all the way down, and then discard. Again, start right in the center and just roll all the way around. Take your time, you're going to allow it to dry. One more. Now these catheters are pre-lubricated, but if you had a patient that you were worried about, maybe he has swollen prostate from benign prostatic hypertrophy, then you can always have extra lubricant, and we could add some and just go ahead and lubricate this catheter. But this catheter is lubricated, so we're going to go ahead and use this now. And notice that this catheter, it's just a straight catheter, so we want to make sure that it's going to drain right into this tray so we don't have a mess. You're going to insert 6 to 8 inches of this catheter into the male patient because they have a much longer urethra than females. Are you ready? All right. So hold the penis at a 90-degree angle and hold firm, because when you start inserting, sometimes it will try to move away from you. So here we go. Take a deep breath. 1, 2, 3. And just gentle sliding, gentle sliding, gentle sliding. And finally, you're going to get urine when you're almost to the very end, because again, they have a very long urethra. Make sure your tray's there. And then we're just going to let it drain on its own. And we're going to kind of monitor it. We don't want it to drain more than 1,000. We don't want him to have any bladder spasms. Okay, so it looks like he's done. So I'm going to pinch this just so it doesn't, dribble all over and make a mess. And I'm going to go ahead and remove the catheter. Deep breath again. All done. Good job. I'm just going to wad it all up in this paper, wad it up in my glove, discard it, throw it away, and I'm going to take my urine tray, or I'll have my assistant take my urine tray, measure it, record it for intake and output. So we'll get rid of that. And then we're going to go ahead and clean up the patient. If we need to do pericare again, we would have gloves on, use soap and water, do pericare again, make him comfortable, remove everything, all the gloves, cover him back up, We need to wash our hands again. And hopefully he is more comfortable. All right, hand hygiene again. Do your exit procedure. Make sure that you make sure the patient is in a safe position. We're going to put this bed down. His call light's within reach. His bedside table will be put back. If he has a cell phone or anything that he wants next to him, we'll make sure we have all those set for him. All right, thank you.